What up? It's the PAC, man. All things physician associate. And in this video, I want to talk about PA school expectations, man. I was thinking about it this morning based off of this stemmed from someone who recently asked me a question. Excuse me, they're like, man, what is PA school like? Is it something I can do? That's tough question, man, because anyone can do it. If I did it, I promise you, anyone can do it. But how much are you willing to fight to win? Like, PA school packs a mean punch, and it's gonna put you on your butt, and it's on you if you want to stand up or you want to stay down for the count. So it was hard to answer that question for the person who asked me that, because I don't know how bad you want it. I needed it. Like, I'm gonna get you. So it was do or die for me. So in that capacity, the universe has a tendency of moving out of your way when you're pursuing your dreams. And so it depends on why you're doing it. I can tell you, let's break down PA school a little bit. So boom, you applied to PA school, you went on CASPA, which kind of helps, almost like put your application in front of many schools, depending on your criteria, as far as, like what states are you willing to travel to and what have you. And then they, certain schools will review your application and say, yeah, we'll interview you, and then they'll send you an interview, and then you fly out to them. Unless it's local, you just go to them and you interview, and then you'll receive an acceptance letter from a couple of them, hopefully, and then you decide, who you want to go with, right? So let's say you've gotten through that part, and you're now, oh wow, you're ready to start. It's day one. What is your expectation in PA school? It's not prereqs. Like, all the prerequisites that you've taken up to this point have absolutely nothing to do with PA school, in the sense of it is not like you had a lot of say in the prereqs that you took, as far as how you take them, whether you decided to do some online courses or show up in person, or some hybrid, or take a semester off, or only take this class with this class so you don't burn yourself out that semester. None of that exists in PA school. PA school is, we're gonna punch you in the face with a bunch of classes really hard, just to see if you're really as tough as you say you are. And so PA school is, I can tell you in my personal experience, and this is pretty standard for PA schools across the board, my program semester one was 9 classes. And as far as the 9 classes go, we were hit with like exams every single day. It felt like it was just a constant, like we couldn't breathe. We were there for 8 to 10 hours a day, sometimes 12 hours. Sometimes they made us come in on the weekends. Like if a professor didn't have enough time to cover all 10 of their PowerPoints on a Friday at 5-6 p.m., they're like, I guess I'm gonna have to see you here in the morning until I finish these PowerPoints. You guys belong to me. And it's just exhausting. It's just more than it's like a full-time job with overtime, but just using your brain primarily. And so those 9 classes, some of the classes included what we call, pharmacology, of course, the most daunting course of all. Unless you have some type of background with drugs, it is extremely challenging class. And the class, it's tricky, because you need to know everything about the drug. You need to know, what is this drug used for? What is the mechanism of action? How does the drug work in the body? What is the drug-drug interaction? What other drugs does this drug interact with, positively or negatively? what are the known adverse effects or side effects, and just, you know, and just, if you can't give this drug, then what's the second line drug? What else can I give if this is contraindicated for whatever reason? So, and what do guidelines say about giving this drug, and what should I expect this drug to do? What is the outcome of this drug? It's just a lot. And it's not just a question like, hey, what does this drug do? No, it's this whole, what they call a vignette, which is like a storyline question. Like, it's a 53-year-old male presents with this, that, and the other. And these are the lab results based on your interpretation. What's the next best step in management? And here's a long list of drugs to choose from. And you're like, whoa. And so it's a tough class. That's one. Then we took pathophysiology, which is the study of disease. So up to now, you know anatomy and physiology, so you know what the human body looks like and functions like. Now let's add a disease to the mix. So now it's the same patient, let's say 53-year-old male presents with this, that, and the other. Here is a CT scan of the abdomen and blood results based on your interpretation. What is the most likely diagnosis? And then now you're like, okay, so this patient most likely has this. So that's pretty much patho in a nutshell. And then you have, it's time to start learning how to do physical exams, history and physical exams on patients. So you have like your lab stuff. And your lab stuff is in the beginning, you practice with each other, right? Like your classmates, like you'll partner up. Like, okay, let's say you and Sarah are partners. So Sarah's gonna go in a room and ask you, you know, do a full physical exam on you, and then you're gonna do it back on Sarah, and you guys are gonna practice with each other till you get comfortable. And then we called them head to toe. So they wanted you to be able to perform a full physical exam from head to toe. And then as you get good at that, then the school starts to test you by bringing in, either the professors will act as the patients, and then they're also grading you on your performance, or they'll, as you get further along, they'll start to hire or get volunteer patients to come in, and then you have to do and they already come, you know, they give them like a laminated paper with the condition that they have and the signs and symptoms that they have. So you just walk in and they already know what disease they have, right? So then you get to read the beginning, you get to read your own little laminated card that says, you know, you've walked into the room of a 32-year-old female in the emergency room complaining of right lower quadrant pain for 2 days duration. And then you may begin. Okay, so, hi, Mrs. Williams. My name is Peter Molina. I'm a PA student. What brings you to the emergency room today? And then you got to start asking a series of questions to start to draw your or at least your differential diagnosis, your possible list of what this could be. And then at the end, they want you to just figure out what it is, give them your diagnosis or your presumptive diagnosis, give them your treatment plan, how you're gonna fix this problem, and then that's your grade. So that's kind of a fun class, but it's hard. It's hard because it's hands-on stuff too, you know, but it's cool. And then there's a multitude of other classes. It's a lot of work, and it's all, you don't go see real patients, you don't do any of that year one. You just gotta, you learning theoretical, like it's all in the books, and practicing with each other. Once you finish successfully the first year, that's like fall, spring, and summer, then if you successfully complete all of that, then you go off to clinical year. So year 2 is all about your rotation. So you're about to go and rotate with an actual practice. Like you're either going to go to the hospital and go to the emergency room to do your rotation. That'll be 4 to 8 weeks depending on your program. And just to kind of give you an example, like you walk into the ER and no one's like, it's not like the airport where they're holding a sign that says Peter Molina, oh, right this way, sir. No one's waiting for you. No one knows you're coming. No one knows your name. You just kind of walk in and you got to kind of figure your way. Like I kind of look for anybody with a white coat. I'm like, okay, that looks like a doctor there. And I'm like, hi, my name is Peter Molina. I'm a PA student. Can I rotate with you for today? And they're like, oh, I'm just leaving. I'm getting out of here already. You gotta wait for the next shift. Just have a seat. Next thing you know, have a seat doesn't mean we'll get to you in a moment. And they forgot about you the second they stopped talking to you. So it's like, okay, you notice that he's talking with another doctor. I guess they're giving a report, and then he leaves, and then the new doctor comes on. So I give him like a second to settle in, and then I approach him again, like, hello, my name is Peter Molina. I'm a PA student. Like, can I follow you around today? They're like, yeah, sure, just stay out of my way. So it's not easy. And or they're like, some people are nice, some people are not. That's always, you're always gonna find that in the workplace. And then not all rotations are like that. Some rotations are actually expecting you, like, you know, you do a family medicine, you do a pediatric rotation, you do a psychiatry rotation, you do an OBGYN rotation, and those are pretty much the mandatory ones. And then besides that, you get a couple of electives where you get to kind of choose. If they have that rotation available, they'll try to place you there, meaning like if you've always had an interest in dermatology and we have someone who's willing to take our students in dermatology, then we'll go ahead and we'll place you there, but it's not guaranteed. And or you can kind of find your own rotation. If you know a dermatologist that's willing to take you on as a, precept you, then you could submit that application to the school, and they'll try to accommodate that for you for sure. So that's one thing. And then so you finish all those clinical rotations, and then you successfully, and periodically while you're doing those rotations, they'll have you come back to the school and again do one of those mock practice lab things with a patient, but this time they're getting way harder. They're not giving you any information, and at first they're kind of like helping you out a little bit, giving you a lot of information, and the signs and symptoms are very specific, and towards the end they're very vague and very life-threatening. So they want to know if you fail, if you miss this one, if you miss a cancer, or if you miss a life or limb-threatening condition, you fail. Like, you can't miss cancer on someone. You got to be aggressive, and you've had plenty of time to practice, so you got to be better. So they take it serious. It's not as fun as in the beginning, like, well, that was fun, I diagnosed strep throat. Now it's like, whoa, colon cancer. Like, these conditions are getting way more serious, and I need to be more focused. So that's kind of, and then so once you complete all of that successfully, then the school submits your official transcripts, and then you're able to apply to take you're able to sign up and register so you could take the PANCE, which is the national exam, 300 questions. You have 1 minute per question. So PA school, when you take tests, they try to start conditioning you. In the beginning, they give you, like, at least as far as my program, they give you 2 minutes per question. And then as the time moves on, they give you less and less time, so they bring you down to 1 minute per question. Or like in the beginning, it'll be no time, but then they start adding the timer just so you start getting used to reading and answering the question faster. And they're very long paragraph type but storyline questions, so they're time consuming, especially when you have to interpret lab results and stuff like that. So 1 minute takes a little, conditioning, but we've all done it, so you'll do it as well. And then so the PANCE, 300 questions broken into 60 blocks. 5 60 block questions. You're given, I think you're given like a total of like 45 minutes of break. You use it how you want. So if you want to go through 2 blocks and then take a whole 45-minute lunch break, whatever you want to do, like, or if you want to do 1 block, take a 10-minute breather, 1 block, 10-minute breather, however you want to distribute that time, that's on you. And then you pass the PANCE, and then once that makes you a certified PA. So now you're a PAC man. And then you're finally able to apply for licensure in your state, where you just go on the Florida Board of Medicine. I'm using Florida as an example because I'm in Florida, but you go on the Board of Medicine for your state and you apply for licensure, and then now you're a licensed certified PA, and now it's time to go out there and and get to work in the specialty of your liking and kill the game, man. Anyways, I hope this reaches whoever needs this type of information. If you have any questions on it, feel free, man. I'm always here. Love you guys. Stay safe.